Okay, so my screen is visible to all.
Yes.
So now today we'll start with, we've completed with metabolic disorders. Now we'll start with gynecological disorders. Okay, or in first gynecological we will go for dysmenorrhea. Okay, this is syllabus for your this obstetrics and gynecological disorders, menstrual disorders. First we'll go for today dysmenorrhea. Okay. So for this, first we'll see that what is the reproductive organs, all the parts of the reproductive organs. So it involves not so required, but still to see its function is to make eggs and you have studied anatomy and physiology reproductive system, all of you.
Yes, ma'am.
Okay. So its function is to make eggs and provide a place to support and nourish the developing embryo, okay, or human means that embryo. The internal structures of the female reproductive system involves all these organs. External structures involves this, and this is not required, okay. These are used for the protections, areas, etc. Now, first we'll go for dysmenorrhea. This is the main thing which we have to understand. Dysmenorrhea. What is dysmenorrhea? So it is literally a means for the, and usually we used to say it as a painful menstruation. While menstruation, when it is too painful that and up till the limits or normal conditions, then it is called as dysmenorrhea. But a more realistic and a practical definition we can include in this case is painful menstruation of sufficient magnitude so as to in, incapacitate day-to-day activities, or it hinders your day-to-day activities. In normal, how you will differentiate, in normal also females used to have the pain, but when it will hinders your daily activities or reducing your quality of the life at that time, and it up to certain limits, then it will be called as dysmenorrhea. So types of dysmenorrhea are primary dysmenorrhea. First, it leads to the primary dysmenorrhea and secondary dysmenorrhea. First, we'll go for what is primary dysmenorrhea. The only difference is one we'll see. Okay, so pain usually begins 1 or 2 days before. Okay, before the periods and or their menstrual cycle, when bleeding actually starts, or can last for the several days within the menstrual cycle or after that also. Okay, so the pain usually happens or begins before that and can lead further after that also. You may feel pain ranging from mild to severe in lower abdomen. Okay, back or thighs pain can typically be, it can leads to or can go for 3 days also, 72 hours. Okay, from 12 to 72 hours. The pain is often caused by the uterine muscle. Main cause for it is uterine muscle contraction. Though the exact cause is unknown for all these types of diseases, but still the main thing is uterine contractions. There is a layer inside the uterus. The inner layer of uterus is called as. Can anyone name it? You have done with reproductive system. I know
What, ma'am?
End,
inner layer,
endom,
inner lining of that uterine.
endometrial,
Endometrium.
endometrial lining.
Myometrium line. Okay, myometrial lining. Okay. So this is a uterus layer. When there is too much contraction in this, this can lead to excessive pain. Okay, this too much contraction also called as hyperactivity. We'll see the main cause is uterine hyperactivity, uterine muscle hyperactivity. Okay, in causes we'll see the same thing. And though this contraction which is help to shed the uterine lining out, contraction is required in normal conditions also. Contraction is required to shed off that blood out of the body, but when there it is excess and it is unbearable, then person is not able to bear it, or it hinders its daily activity, then it can be called as a dysmenorrhea or can be leads to the primary dysmenorrhea condition. Primary dysmenorrhea is one where there is no identifiable pelvic pathology. That means this is the main difference between, we'll see, primary and yeah, secondary dysmenorrhea. What that in primary dysmenorrhea, no identifiable pelvic pathology. That means no certain cause or any medicated cause is known. Like, okay, therefore no underlying medical condition. Okay, there is no medical condition which is leading to it. It is happening by itself. But in secondary dysmenorrhea, it can be done by any of the medical conditions. Okay, underlying causes for that is medical condition that further can lead to dysmenorrhea. Then that type of dysmenorrhea will be called as a secondary dysmenorrhea. We'll see ahead. Usually in adolescent girls, it usually happens in adolescent girls and who have the normal reproductive organs or reproductive system, normal activities, but due to these problems, they are used to be called as primary dysmenorrhea. Appears within 2 years of the menarche when they are, what is menarche? Who will tell?
When the menstruation cycle starts.
Okay, first menstrual cycle. Okay, is called as menarche. And what is menopause?
Stopping of menstrual cycle.
Okay. So when first menstrual started, it could happen that it could be in the range of 2 years or can be more. Not like that, but usually may be seen. Okay, appears within this causes. Psychosomatic factors, as I told, that main causes everything related to our mental status
What did you told about this menarche appears within 2 years?
of
What
menarche.
it
Then
means?
that means appears within 2 years of their first menstrual cycle. It could appears within 2 years of their first menstrual cycle when they are identifiable with primary dysmenorrhea. If they really have this problem or this condition, then it could happen within 2 years of their first menstrual cycle. Okay, so
Okay.
causes psychosomatic factors that is related to their mental status or their stress, anxiety, depression, all levels can lead to uh, this problem. As I told, that stress is the main cause for all the diseases. And now the one thing, as I told, that most important for this causes is uterine myometrial hyperactivity. Hyperactivity means, as I told you, that a contraction for everyone, normal girl also, contraction is required to shed off that blood out. But when it is hyperactive or it is matlab, hyper, everything is not good for our body. Okay, so when it is hyperactive can leads to this problem. Okay, because due to excessive contraction in these muscles, myometrial muscles, the pain will be caused. Okay, so can happens due to the hormonal imbalance. This hyperactivity of your uterine muscles could happen due to certain things are told, that hormonal imbalance will be there, or if there is uterine fibroids, or certain medications can also lead to this hyperactivity of your myometrial layer of your uterus. Okay, so main cause is uterine myometrial hyperactivity. Psychosomatic is very common cause for all the disease. Imbalance in autonomic nervous control on uterus muscles. That means there is a not proper nervous control on our uterus muscles. That means excessive contraction is happening. It means that not in the control role of the prostaglandins, vasoconstriction. Actually, prostaglandins is a hormone which is required for, what is the work of prostaglandin? Who will tell?
Ma'am, it secretes sex hormones, is it?
What is its function? Anyone can tell. No one.
Is it for contraction of uterus?
Actually, it is for contraction of the uterus. And one more thing I will say, actually it works against, because it works against or it is helpful in the condition. We'll see further slides, when there is inflammation, pain, and uterine contraction. For all these, it is effective because it is a hormone that affects several bodily functions and body functions, that it works with inflammation, pain, and uterine contraction. Actually, it maintains the amount of contraction should be happen in the uterine walls. Most probably this. Okay. Usually, actually, in the yoga researches, when one of my like college mate, or you can say PhD colleagues itself. She is doing on the this dysmenorrhea. So prostaglandin test she wants. It is very there are no prostaglandin test she is getting actually. So this is true. And also, if you will get it, it will be very very costly. But still, she is not getting that. So
Ma'am, our research, ma'am, Geeta madam is also doing on,
dysmenorrhea only.
yes.
Okay. So how she what she is telling about like this all this something she's telling about like dysmenorrhea.
But
What?
told, like, I think she already submitted. I'm not sure. So she talked about it during the classes.
Okay, okay, okay. One second, just wait. Just wait for 2 minutes. Okay. So as I told that it is written vasoconstriction. That means this prostaglandin is usually for contraction and contraction in the muscles layers, and also useful in menstrual cycle, normal menstrual cycle also, and also for the labor. Okay, while delivery of the baby. Okay, because usually happen for the contraction, proper contraction to maintain proper contraction in uterine walls. So symptoms, as I told, spasmodic pain confined to in lower abdomen. That means you will feel that some spasm is happening in the lower abdomen. Such type of the pain. Pain begins few hours or before, few hours before, just with the onset of the menstrual cycle. It will happen few hours before it will happen. Normal symptoms are also these similar. Okay, sometimes may radiate to back and medial aspects of the thighs. Okay, it can goes from the back to the thigh region also.
Why?
Nausea, pain.
Yeah, yeah. Why it goes into the thigh and all?
Normally also females used to have not for all, but normally also female used to have this pain in some have certain different symptoms. Some have back pain, some have abdominal pain, some have side pains, some have thigh pains. Normally also it happens, but in normal its symptoms also very much as I told you. In normal condition also these are the symptoms. Okay, so it
Yeah,
can
yeah.
radiate from back to the thighs also.
Yeah, yeah, it happens, but why it happens? Like why it goes to the thighs and all? Because
Due to the
uterine muscles are
excessive
contracted,
contraction,
right?
due to the excessive contraction, hyperactivity, I told you,
But it
hyperactivity.
happens in uterine, na ma'am.
Yes, it is
Like,
happening in uterus, so it will affect your lower organs also. Okay, nearby organs.
okay.
So nausea is a thing, but like you will feel that vomiting is there. Matlab, you feel like vomiting, but there is no vomiting. Nausea could also happen or vomiting because this is the condition. It's a diseased condition. In normal condition, also female have this pain and all, but this is disease condition, so some different thing. Okay, fatigue, diarrhea, headache usually. Okay, or tachycardia. The tachycardia is nothing but overactive heartbeats, you can say, or abnormal heartbeats. Normal person have from 60 to 100 approx, depend on person to person, uh, heartbeat. But if it is more than or above than that of 100 beats per minute, then it will be can be said as abnormal heartbeat. Okay, so this abnormal heartbeat is termed as tachycardia. Okay, so treatment for that psychotherapy. Okay, and this non-steroidal anti-inflammatory drugs, that is NSAIDs, and prostaglandin synthesis inhibitor. This is now, as I told, what is primary
Ma'am,
dysmenorrhea? Can anyone tell?
what is inhibitor here?
One second, I'm just thinking. What is the? Can anyone tell that what is this A's word we use for at the last? No, anyone knows? as in cardiac word is for heart, and that for what we use this ACE word.
Ma'am, production.
Um, for like lipase, we use ACE. Now you can recognize it.
Protein.
Protein.
I don't know.
ACE word is used for enzymes actually. I'm just seeing for this. This means this nothing prostaglandin synthesis inhibitor means release of the prostaglandin. If there is because due to prostaglandin maybe no contraction is happening, blood is not shedding off. If there you also see in the normal cycles also, if blood is not shedding off properly up till the days blood is not shedding off properly, you could have the pain. Okay, or that could be for half day, for one day. If proper bleeding happens, the pain will goes off. So prostaglandin inhibitor means prostaglandin is required, so we to treatment we have to work on the prostaglandin, so there should be more prostaglandin. Monotum inhibitor, these are the medicines to increase or increase this amount of prostaglandin in the body. Okay, as I seen here and widely
Ma'am,
used
what
in
did you say for ACE, ma'am?
as I told na enzyme
Oh,
for actually these lipase all these comes underly as it there's like for respiratory system what we use for liver, a cardiac what we use for heart. Okay, so like that these are some terms which we can recognize very easily. So whenever there is an itis word we use for
the
Inflammation.
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 Inflammation, okay. That's similarly A's word is used for enzymes, okay. We'll go for secondary dysmenorrhea. In primary dysmenorrhea, what is happening? There is no underlying medical condition. But in secondary dysmenorrhea, only difference is there is underlying medical condition which is further leading to dysmenorrhea. That will be considered as a secondary dysmenorrhea. Normally considering to be menstruation association pain occurring, like normally pain is occurring but in the presence of pelvic pathology, but it is just happening in the presence of pathology or some medical condition. Okay, it results from the reproductive system disorders. As I told you, it will come from any other disease, okay, or any other problem or any other condition. Okay, so as it is told that other reproductive system disorders can lead to when certain other reproductive problem conditions leading to dysmenorrhea, that type of dysmenorrhea will be considered as secondary dysmenorrhea because 2 degree. Okay, secondary dysmenorrhea. The pain is often more severe than that of the primary dysmenorrhea. May starts earlier in the menstrual cycle or last longer. Can start before few days of the menstrual cycle and can lead to after few days also. Okay, and pain is more than that of primary dysmenorrhea. Causes are chronic pelvic infection because as I told it will consist some medical conditions. So these conditions, these medical situations can further leads to dysmenorrhea, and this dysmenorrhea will be considered as secondary dysmenorrhea. So or uterine fibroids, myometrial polyps nothing but a accumulation of mass type of thing. Okay, and then where we have studied polyps, one like in which system? Can anyone tell? Huh?
the nose polyps.
Nasal
Yes,
polyps.
very good. Nasal polyps. Okay, pelvic inflammatory diseases, inflammation in pelvic region. It can further leads to dysmenorrhea. Clinical features, normal clinical features like dull pain situated in the back and front without any radiations. Okay. Now, yeah, appears 3-5 days prior to the periods or normal menstrual cycle, relief with the start of the bleeding. As I told you, when bleeding will or normally happen, it can be relieved of. Normally, also it can be relieved of. But at the time of the pain, it is such a severe pain that it beyond the pain of the primary dysmenorrhea. Okay, Duration of the pain depends on the pathology, what condition or what problem can lead is leading to dysmenorrhea. Treatment that aims at the cause rather than the symptoms. Why? Because we need to go for the changes or improvement in our causes, because these are underlying medical condition, these are due to underlying medical conditions, so we should go for the correction in our causes. It will definitely will going to cure for dysmenorrhea also. Now yogic
Ma'am,
management. Yes, ma'am.
can you show the second last slide?
This one.
No, no, no. Before this.
This.
Yeah. Ma'am, can you explain this uterine fibroid again?
There are some family, like if this is uterus have some fibroid like structures. Okay, usually this is called as uterine fibroids, formation of fibroids in the uterus.
So, like, what happened, ma'am, here? Like,
So
fibroids form in the.
no proper release of egg or will happen, less egg quantity or no proper release of the egg will happen like this. These all conditions also lead to
Mhm.
PCOD and all
In
disease.
ovaries, right, ma'am? In ovaries.
What?
You're saying na no egg formation, so it must be happening in your ovaries, right?
Oh, okay, okay. This uterine fibroids you're saying. Okay, so if fibroid formation in uterus, maybe it can leads to uterine fibroid, because it will not give the because it makes a person to even conceive, because it will there will be no space for for implantation. Say that is the uterine fibroid.
Okay, okay.
Okay,
Thank
no
you, ma'am.
space for that also. This is nothing but we have to work on the causes as it is told. Now, these fibroids are nothing, as I told in one more slide before, that accumulation of mass. That itself is a like a polyps or accumulation of mass. It make a structure like this. What in Hindi also, like we say na, that you have like किसी को गांठ हो रहा है, वो भी कुछ नहीं, like tumor हो रहा है. Tumor is nothing but accumulation of mass itself. These all are same. Someone might.
Can I say cyst?
Yes, seeds,
Cyst,
cyst.
ma'am?
Yes,
Yes,
therefore,
yes.
peace, etc. Have these conditions of fibroids only. Actually, what happened? This fibroids or cyst can even happen in ovaries. Okay, or can happen in the in ovaries also, or can happen in uterus also. Okay, so you mainly used to see that uterine fibroids. Okay. But these fibroids or these things are non-cancerous. We used to say benign tumor. Used to say, na, these are non-cancerous usually. Okay, just you can say accumulation of mass, but it is non-cancerous, like a benign tumor we used to study in cancer and all. Okay, so yogic management, like for all the females, normally also we used to should practice for all these opening, like a normal pelvic opening part for further conceiving properly or without any hindrance. So Annamaya Kosha, we used to for the asanas first directly we'll see that butterfly pose. These are all pelvic opening. You will see Upavisht Konasana. Everyone knows about Upavisht Konasana.
Seated forward bend, ma'am, wide legs.
Yes, yes, like Bhunamanasana we used to call it. Holding your legs, we're sitting here, and your spreaded legs in front and going down just okay. Baddha Konasana with folded legs. Okay, again just touching your
Ma'am,
knees on the ground.
isn't butterfly and butterfly same, ma'am? No.
No, voice is not audible to me. What are you
Ma'am, I'm
saying?
saying, ma'am, I'm saying, isn't butterfly and Baddhakonasana same?
No, in butterfly we used to do up down, flapping your thighs on the ground. Up down,
Ma'am,
up
in
down.
Baddha Konasana, we have to touch our forehead to the ground. Is it like that? Means we
Also,
have to pose like butterfly. Then we have to bend our forehead and touch the ground. Is it
yes,
same
yes,
Baddha
yes.
Konasana?
That's Suptabhadrasana, no, ma'am. What
What, ma'am?
Lepalika ma'am is saying. What
What?
Lepalika ma'am is saying, it is Suptabhadrasana, I think.
Actually, in Baddha Konasana, we used to just sit and press that out down. Okay, these all our thighs on the ground. Okay, that is Baddha Konasana. Okay, sitting straight and spreading your thighs on the ground. Just okay, and like a butterfly, you are
Okay.
bringing your heels near to your pelvic region as much as possible. You never see that if you will bring it near, your thighs will be spreaded, your pelvic region will be spreaded. Okay, for further more expansion, or if you can do up to your capacity, you can bring your head down. That is another condition. But normally for simple terms, we go for Padmakonasana, Dhanurasana, Ashtrasan, etc. Setu Bandhasan. And usually for PCOD girls, na, used to give that obesity practice only. Dynamic practice we have to give them. Okay, dynamic practices
Ma'am,
to burn out it like that.
how Dhanurasan will help?
Dhanurasan will press all. Dhanurasan is for all the vital organs. Dhanurasan is best asan, you can say.
Like,
Okay,
ma'am, uh, if we will be lying down in a prone position, so our stomach will be like pressing down, na?
pressing
So it
down, it is good. It is good. It stimulates because there is the main cause is imbalance in your hormones. It will stimulate your all the organs. Okay. Further, the proper release or proper activation of what should be done, what not should be done will happen like that. Proper
and
activation.
ma'am, and what if the girl has back pain
So
then?
that in every problem, you have that contraindications. You will you have to give like that with that indications. In that condition, if you want to do Dhanurasana and girl have back pain, first of all, you should know Dhanurasana is very good practice for back pain. Okay, but still, if she is feeling difficulty in doing Dhanurasan, she can stay her head down only, or no, her thighs on the ground itself, and just hold your ankles and raise your upper body up. That's it. Is enough. Okay. But this is wrong that you are saying that Dhanurasan is very good practice for back pain. Okay. These Shalab, Dhanur, back, all, and Bhujangasan, all these are very good practice for. Other practices like Pavan Muktasan, all are also given here. But everything I can't write, matlab we can't write, na. So those are also very good, okay. Malasan,
Ma'am, I think there is a little confusion. So I think uh, I'm not sure. Sakshi is thinking this has to be done during menstruation, but these are preparation for the 25 days we do this, ma'am.
yes,
5 days during period we don't do all of this.
yes, ma'am, yes, yes, that only I'm saying. So, acha, Sakshi ma'am, you are thinking that at the time of the practice we are doing this.
Yeah, that's why I was saying.
Sorry. Okay, okay. Actually, at the time of menstrual cycle, we have to relax our all the system, take a whole system. So we don't used to go for practices, but certain practices are good. Even we should do at the time of the menstrual cycle, but for relaxation of your back only, like Pavan Muktasan, no practices that are pressing your abdomen. Okay, those practices. Ustrasan you can't do while menstrual cycle. Okay, so like that. But as I personally I used to do advanced practice. Okay, so before, when I don't know that we should not do these practices at the time of menstrual cycle, I used to do all advanced practices during menstrual cycle, but this is not good. Okay, so during menstrual cycle we used to go for pranayam, except
Ma'am,
kapal
what if we does, ma'am, what are the side effects like if we are menstruating and we does all these asanas, then
I
what will happen?
I don't feel any problem while doing these practices when I'm doing all the advanced asanas during menstrual cycle. I don't feel any problem. But it is said that our teachers used to say that it is said that after few when at the time of the pregnancy it could cause the problems. Okay, so at that time you should relax or your whole system. at time pregnancy or some imbalance in hormones or what any could have happen, है ना? Because our body is getting overexerted at that time, so we should relax it. Okay, like that. I am just telling of my example of mine itself. I used to do everything, but now only pranayam you can go except kapalabhati, because kapalabhati again pressurize your abdomen. If you want to do pressure kapalabhati with very slow pace, that it will not hit at your lower abdomen, but should avoid that at the time of that. Go for nadi shodhan, anulom vilom, brahmari also you can go, all these practices. And even pawan muktasan, that margatasan, side bending, twisting, all that also you can do at the time of this. It will relax or help in proper contraction and relaxation also. Okay, that practices you can do. Okay, that are good, even because at the time of, if girl is having back pain, they can go for these practices, side twisting, nothing to do, just relax mood, and we feel good. That at that time we are not completely like leaving that, but doing a little, that also relieves in pain also. And like we'll go for that rabbit pose. Why? Because at the time and spreading your knees from front, we go for rabbit pose. At that time we feel reliefs in the abdomen pain. Okay, like that some certain practices are there. Or normal sukshma vyayam you can go. At that time you can focus it on your all the joints, because normally we used to practice for whole body. At that time you can focus on your joints with breathing and all. Like that you can manage to do practice. Don't to take leave and do bahana for not doing practice. Okay, so
Ma'am,
Ma'am,
inversions are not supposed
inversion.
to do
Yeah,
because,
inversions are not recommended.
yeah,
yes, ma'am,
go ahead.
inverted postures are not do, but rabbit pose is not a inverted posture. Yes, it is going down, but actually when we used to normally also when female have pain, normal, no, not from the yoga background. To relieve their pain, they used to put like a pillow on under the abdomen, go down and relax. Okay, so in that case we can do that, because it's personally for me, uh, like when I do this rabbit pose, it relieves at that time. So normally if we are not doing in asanas also, that time also to get relaxed, we used to do that. Okay, inverted posture, of course, as I told, in normal practice also we are not doing. So why, how can we do inverted postures? But certain practices like margatasan, these all we can do. Okay.
Ma'am, they say that it is an acidic blood that has to be sent out. So if we do inversions, it will may go back to the body, which is not good. So that is why they say inverted don't do.
Yeah, okay, yes. So
Ma'am,
inverted, yes, ma'am.
okay, okay.
Yes, say.
I was saying that what Rajeshwari ma'am is saying, that it will go again into the body. That I have also heard about it. That is there any chance that from uterus it will go again into the whole body?
No, no. Actually, everywhere you study, na, pinches or like that opening and closing area is there. From
Yeah.
uterus, it can't go back.
It's actually on the basis of our prana yogic measure. Like apana vayu is going downwards,
Ah,
and
yes.
apana vayu is helping for this uterus, that blood to go down. So that's why inversion is not recommended. But it is not scientifically proven. But
But
some
inversion
doctors,
is not done. I am completely satisfied with you. You are saying very right, because we should not go for inversion practices, as we need to blow it out down. Okay. Okay. Yes. Now, what are you saying? Please tell. Someone is saying, I don't know. I can't see you, na. So who is speaking? Just tell. Continue.
I think Shuja ma'am was saying something.
no, I was just telling to Sakshi like about that blood flow. It is not scientifically proven, but some doctors have told that like maybe this endometriosis like diseases, it is on like increase nowadays. So some people, like, it is not scientifically proven, but like in yogi theory we have this apana vayu concept, so that's it. So inversions is not good for such kind of Like it can maybe cause endometriosis kind of things. I don't know.
Okay.
Yeah, yeah. I had, ma'am, this problem in menopause. So there were some, I exactly don't know the term, but the capillaries used to, from side mein, capillaries also used to bleed. So left, right, and center blood used to come out. कहाँ से पता नहीं. So they asked me to be careful.
Okay. So you are doing these practices while this.
No, it stopped, ma'am, now. For 5 years, I had menopause. I used to bleed every single day for whole month.
Okay.
अभी
Due
तो
to
रुक गया.
imbalance, due to hormonal imbalance, it happens. No?
I actually my cycle was all fine, ma'am. But 1 year I took about 10 tablets to postpone my period. That's how meddled with the cycle, ma'am. तो उसका बहुत भुगता मैंने 5 years I suffered. So I always suggest not to take tablets for postponing the period,
Yes.
ma'am.
Because it also affect further if you will taking regular medications, it will affect your kidney and liver also, and certain leads to other problems like that.
Ma'am, from this one question, uh, like, do we have to take like multiple pills to postpone periods? Like for 1 month period, we have to take multiple pills, or just one pill is enough?
I didn't try this. So I don't know. We
Okay,
should not
okay.
go for medications for these conditions. I know that only. And I don't take, I even don't take medications in normal, like fever, cold, cough also. High fever also. I don't take allopathic medicine actually. If it is not a extremes of the use. Okay, so what is the difference between Sarvangasana and Viparit Karni?
एंड सर्वांगासन इज बेसिकली शोल्डर्स भी उस पे ऊपर चले जाते हैं, बट विपरीत वकरणी इज अ मुद्रा. सो लाइक अपनी जो एल्बो होती है, एल्बो से लेके पूरा हिस्सा जमीन पे होता है, एंड अपर बैक भी थोड़ी जमीन पे ही होती है. सर्वांगासन पे अपर बैक भी उठ जाती है.
ओके 45 डिग्री एंगल अप्रॉक्स मतलब वो बना के
राइट.
इस तरीके से सो दैट योर टोज विल बी इन जस्ट इन द स्ट्रेट लाइन विथ योर आईज. इस तरीके से वो किया जाता है और एंगल जो है टिल्टेड रहता है 45 डिग्री. ओके
राइट.
विपरीत करनी मुद्रा वी गो फॉर बट नॉट एट द टाइम ऑफ द प्रैक्टिस. ओके at the time of the this menstrual cycle. Pashini mudra, this is similar to that of like lying down, like Karnapid we do na, like that it
या.
is wishing that. Now Yog Mudra is somewhere like different place. People used to give different. As I in morning, like my Guruji used to teach me Yog Mudra. Like you say Dvipad Skandasana, Dvipad Skandasana. Both the legs behind your neck when you put and just lie down in that from your backside. That is Yog Mudra. He used to say, but normally in normal terms, Yog Mudra, like in SVasa, they this rabbit pose itself, Shashanka Asana, they itself called as yoga mudra. Okay, so for different things, the different things are there.
In my
But
institution, it was different, ma'am.
what
Yoga,
that
in
Badrakon
my
type of Badrakon?
Yeah, like when my sir used to say Yog Mudra, then we used to take like do Padmasana and then we hold
Put your
our.
head on the knee, head on down.
Yeah, yeah.
Yes, yes,
And
I also even go through that also because in Patanjali when I studied they used to do yoga mudra like that. So everyone have different concepts, but here it is that related to you can relate with two things, but the con type like head down on the ground with spreaded knees on side and also in like Shashankasana thing. Okay, that is also called as yoga mudra many places. Okay, so as I told before also that someone is saying that Shashankasana we don't used to do while this menstrual cycle we can do. Okay. Now pranamaya kosha, for that we'll go for pranayam. Vibhagya pranayam itself is sectional breathing. Nadi shuddhi, suryanulom lom, chandranulom lom, shitali shitakari brahmari. Okay, all cooling pranayams. Now manomaya kosha, Om meditation, MSRT to maintain the vibrations within and out and relax your brain, mind. whole body calmness. Began में कौन सा yogic counseling, you go for and reading books and all, and making them understand about their problem, letting them what is the actual cause, what is the actual reason for causing it, what is the pathophysiology of it, and how it can be released by the yogic practices. That is called yogic counseling. Then Anand mein pucha happy assembly, satsang, and everything like their spiritual activities. All. Okay,
What is CM, ma'am?
what ma'am?
CM.
CM is cyclic meditation. Everywhere
Oh,
I kept, but here I didn't write this CM is cyclic meditation.
okay, okay.
Okay, so with this, we have completed with dysmenorrhea. So should I ask question now or
I'm okay, ma'am. Ask others.
otherwise tomorrow in starting itself I will.